I'm Dr. Zahra Pakbaz. I am associate professor with the University of California School of Medicine, and I practice mainly I see non-cancer blood disorders, which also is known as benign hematology or classical hematology recently. A lot of people try to avoid talking about, calling it benign hematology these days because we feel that it kind of underestimates the clinical importance of this condition. Patients with benign hematology can actually have life-threatening disorders such as sickle cell disease, that patients don't live longer than 40 years, or they can have hemophilia, that they can have a fatal bleeding, or patients with thalassemia that to live, many of them they depend on blood transfusions, and these blood transfusions can be life-saving. And then I just wanted to add a correction that the sickle cell patients, we try to provide them with the best care possible, but still the average age-wise life expectancy is between 40 to 50 years old in California, at least. So as you see, benign hematology is not it's not, something benign, don't worry about it now. It doesn't matter if they don't get the care right away, or so the quality of care is important, as important malignancy, and it can be life-threatening. However, many times these patients are being overlooked. There is not enough hematologists who know about, who are experts specifically in benign hematology, especially adult hematologists. These patients, like patients with sickle cell, thalassemia, they used to, they wouldn't become adults. So they would not survive until adulthood. But now, because medicine has improved so much, these patients pass through pediatrics, then adolescents, then become young adults, and then adult. But our care team that is necessary now to take care of these patients throughout their life has not been developed. So, there is a special need for adult hematologists to be able to take care of these patients, and really, because it's different from, okay, I'm seeing this patient, or, oh, I know what am I doing. I'm not just monitoring these patients, but then there is shortage because of the reason I told you, that these patients all now grew up and they survive to their adulthood, but our medical system is not ready for that still, although we are in 2024 now, right? And then, like you may see a 50-year-old person is going to a pediatric clinic to get their care because that's where the experts are. And rest of their care has to be in an adult facility. And there is not always a good connection between a pediatric program outside of an adult program. That is needed for a lot of coordinations. So that's the real problem, that, okay, there's no problem. You go see a pediatric doctor who is also specialized in taking care of adults. But it's not just about the disease, and it's also the coordination of the care, and that affects the quality of care. So there has to be a very good connection between adult hematologists, pediatric hematologists, the primary care. So it's a lot of efforts. So that's a major issue. So now I realize that at ASH, American Society of Hematology, has been trying to fund some hematology programs, training inside the more developed hematology oncology trainings that are higher value in terms of providing teaching to train more hematologists. And then some of these, and then with a strong benign hematology curriculum. So that's now, since the need is really felt by system as a system-wide problem. So that's what is happening now. And then I think this started last year. So um, so that's now the development. But there's still, when you call when you call the field classical hematology, although they are trying to, raise the attention that this is not just a, easy thing to take care of benign hematology patients. That also, when you tell the patient, okay, I'm a classical hematologist, I don't think they really understand what does classical hematology mean. So but that's what it has been chosen right now, and American Society of Hematology is kind of advocating to be called, instead of benign hematology, classical hematology, or we could call it non-cancer blood disorders to be more understandable for patients.